There are three major types of pain around the hip that people perceive as hip pain. One is pain that's actually truly from the hip joint itself. Typically, arthritis pain hurts inside the groin, down into your thigh and into your knee. That's the most common pattern. The second type of pain is pain we associate with what's called trochanteric bursitis. That's the bony prominence on the outside part of your hip. That pain is typically an area that's very tender. It can hurt to sleep on it at night. So that's bursitis type pain. And the third type of pain, which is maybe the most common of all, is not actually coming from the hip itself, but the low back. All three of these have very similar treatment strategies. Number one is some sort of activity modification. If you notice a particular activity that really bothers your hip or that area of pain, you typically want to avoid that. But it's often good to perform other exercises. So in general, for most sorts of hip pain, a physical therapy regimen or a home exercise program is helpful. For arthritis pain, there are certain physical therapy exercises and strengthening of the hips around the muscles. For bursitis type pain, there's typically a combination of IT band stretching as well as what we call abductor strengthening that a physical therapist can work with you. And for the low back pain, it's typically a combination of some type of core muscle strengthening in your back that can be helpful. In addition to that, there are medications that can help with chronic pain. Typically, the ones we would want to treat with these are non-steroidal anti-inflammatory drugs, so-called NSAIDs. Those are such as ibuprofen or naproxen, or there's prescription grade versions of those. Tylenol is another option for treating pain. And the third option for each one of these things can be a cortisone injection.